it is that time. The song has been playing. You know what it is. You know what's happening. It is Wednesday. Well, if you're watching on YouTube, it's Wednesday. If you're listening on audio on Spotify or wherever you listen to audio podcasts, you never know what day it is. Right now, this is a brand new episode of Because Cannabis from Wayward Media, wayward.media on the interwebs. That's what this is. I am B.C. Wehman. That is Dustin Kava. Dustin, how you doing this week, sir?
Doing amazing. It doesn't even feel like a Wednesday today.
It doesn't feel like a Wednesday. Sometimes the days they come and go, Dustin, you're never sure. But what you can be sure of is that if you hit subscribe, if you clickety-clack that button down below, if you take your finger, maybe you're on a phone, use your thumb. Are you a thumb or finger pusher on the phone? If you had to subscribe right now to Because Cannabis, you've already done it, Dustin Kava. I know that. And it's all of your friends and family, which make up most of our subscribers. But if you had to do it right now on a phone, thumb or finger?
Thumb. I don't even know how. You
hold the phone in the other hand. So you hold the phone in your opposite hand, and then you use your finger to scroll.
I bought the smallest phone that I could find, so I could one hand.
Okay.
I don't know. Big phones are big phones, you know?
Yeah, big phones are big phone problems, people. Either way, big phones, small phones, any size phone, just right phones. You can subscribe to the Because Cannabis podcast here on YouTube every single Wednesday, 4:20 p.m. Or no matter what digit you use, you can head to Spotify or anywhere that you listen to audio podcasts and follow us. We definitely would appreciate that at MEETWM, MEETWM on your social medias, whichever one you like. Head to there, give us a follow. You'll find out about the latest and greatest guests that we have coming on the show. Another great guest today. We're going to talk medicinal entrepreneurship. We're going to talk patience. We're going to talk a lot of different things today, Dustin. I'm excited about that. But before we do, I talk often. I would say and we're close in, I don't know exactly what show, we've got to be 69, 70, 71. We're in the high 70s of shows in a row. You're welcome, by the way. That's why you subscribe. 70 plus shows in a row. And I would say 2/3 of them, I probably comment on your beard and your hair, which makes it a defining feature. If you had to guess, I feel like the beard is super obvious. Do you have a feature that defines you? Do you have a thing that stands out that you make it known? Is it the beard? I think it's an easy out for you, but is it your beard that if someone thinks Dustin Kava, that's the very first thing that comes to mind?
It's gotta be. I mean, I had 3 inches when I was like 13 years old, you know? So I don't think there are many people in this world who have ever seen me without a beard.
That is interesting. What would you say? You've known me for over a decade now. Physically, Dustin Kava, what would you say is my most defining and appealing characteristic? What is that? You got nothing? Is it my oversized forehead? Is it my slightly pinkish red skin when I get slightly embarrassed? That's happening on screen right now. Is it my receding hairline? Which of these features, Dustin? My chubby but cute cheeks? Come on, I got them all going here.
Which of you? I've seen metamorphosis with you quite often, where I feel like sometimes it's with a beard, sometimes it's without a beard. Sometimes I see you with glasses, sometimes I don't. Sometimes I don't know, man. You're kind of like
it's a conundrum, right? You're running from the government with the cannabis industry, always changing your appearance, but yet here I am on camera every week. The reason I want to know, because there's someone who is well known for all sorts of things, inspirational, someone who's well known for all sorts of things, motivational, and every other old type word you can think of. But when I think of this person, their most defining characteristic, and it's mostly because of Jack Black and Shallow Hal, but their most defining characteristic I can think is the giant banana hands of Tony Robbins. Tony Robbins, inspirational speaker, has enormous hands. He's a big dude all around, like he's all around a big dude. I mean, I've never met him before, but thankfully we have a guest who has kind of been in the same vicinity as Tony Robbins, Dr. Anand Dugar from Green Health Docs, greenhealthdocs.com. We're going to talk about your businesses. We're going to get it out there. But when I do a little research here, sir. We get on the interwebs. We check it out. We'll get introductions. But when in doing the research, I saw that you have been in the immediate circle. And he is a gentleman that I have been fascinated by since childhood, seeing late night infomercials, walking on glass, and now into this whole side thing that is going on. Tell me, Dr. Anand Dugar, Green Health Docs, greenhealthdocs.com. Tony Robbins, like, spill it. Tell me everything that I wanted to know, but didn't even know that I wanted to know. Tell me it all. I hope you got juicy stuff.
Oh man. Yeah. I remember when I was a kid seeing like these Tony Robbins infomercials, right? And I would just click to the next thing and never really watch it, right? I just didn't know what it was. And then in 2015, my brother-in-law took me to a Tony Robbins event, the original, like the introductory event that everybody kind of starts at, called UPW, Unleash the Power Within. And I got hooked. I was like, there's something here. I felt better about myself. I felt like it gave me tools to kind of live a better life, a more grateful and happy life. And, I kind of drank the Kool-Aid, and I did all the different programs. I even joined his little special group they call the Platinum Partnership, where I spent a whole year going to 20 different Tony Robbins events in 2019, all over the place, Australia, Europe. We were even in Asia, just all these different locations with a lot of other people that were also just like-minded, wanted to improve both their finances, their spirituality, and their emotional control, and all these kind of areas that Tony preaches about. And so I thought it was an amazing, life-changing experience. I'm no longer in that platinum group just because I didn't, I felt like I kind of graduated from there and wanted to do some new things, but it was a great experience. And I always recommend, if you've never been to a Tony Robbins event, go to the Unleash the Power Within, and you'll probably leave thinking either this is the best thing, or some people just, it's not for them. But for the most people, they usually say it was an amazing experience, even if it's just 4 days of fun.
I remember opening up the cassette book, a huge binder with 19 cassette tapes with him. My mom had a lot of Tony Robbins. I have a love-hate relationship with him in a lot of ways. I was, I think back to my mom, and I think back, and I have this loving aspect. And then I was a part of, or sent to, an organization called WASP, where when you would get in trouble, you would have about 13 or 14 hours in a day, multiple days, in a room sitting in structure, listening to Tony Robbins all day. And so they kind of used it as a weapon, a tool to, like, in a different way. So you
have to embrace the Tony Robbins. I think I bet you, I've never been to that, but I feel like he puts on a good show.
Oh,
like,
you're not walking away
a long time.
I'd be really surprised.
I bet you
walked
it's
out of that convention, and
it's an experience. It's like going to a rock concert for 4 days straight, basically.
That is, it's like a Coachella of motivation, just with one guy going the whole time. Anyway, I just always am fascinated by that, and I always, anytime I think of Tony Robbins, I just look at Jack Black's thing. Go, man, look at those giant banana hands, and he does. Huge man, deep voice. Shout out to Tony Robbins if you're listening, Tony. Call me. I need some motivation. Dr. Anand Dugar, Green Health Docs. Thank you for joining us today on the Because Cannabis podcast. We're looking forward to learning a little bit about what you've done in your journey. I know you kind of started initially going through, the traditional medicinal program, and then, as some of the other doctors on this that we've had on the show have kind of had that same thing, going through the traditional medicinal program, having some realizations about the state of the medicinal world, and then looking into the cannabis. But that's a really quick, succinct version of it. Why don't you kind of just give us your, I guess, background on the transition, you have, if you go there, when you went to school, and then when that kind of transition to cannabis became.
Sure. So I grew up in Texas as my parents were first generation immigrants from India.
Okay.
And, they always wanted us to become doctors. In fact, all three of us, me and my two siblings, were all doctors. And so it was kind of ingrained at a young age that this was kind of the path we were going to go on. And I didn't really think anything of it. I just thought it was what I was supposed to do. And so I did it, and I got through training, and I ended up practicing as an anesthesiologist for several years. And during that time, I would do anesthesia and pain management. And I would see patients come in, and we would give them opiates and other kind of prescription medications. And there was an incident in a clinic where a patient told me, I don't take this crap anymore. I just use marijuana. It works so well for me. And I started doing some research. And that's when I started going down this rabbit hole to see, what's all this about? Because we all know what marijuana is, but it was more of a recreational thing back when I was younger, and not so much really talked about as a medicine. And as I started doing research, I started noticing that there were a lot of medical programs in various states. And I started to reach out to some companies that were doing what I do currently. And I would meet people, talk to them, learn kind of what they were doing. And I ended up basically understanding that there was this massive need in new states where patients were seeking this as an alternative option. And that's what led me on the path of kind of leaving traditional medicine and thinking that it would at least be worth an experiment to see if this really was as good as this patient said. And that's kind of how I started this journey.
There certainly is that first time experience where you as a physician need to kind of step back from everything that you've kind of thought prior when you're hearing a patient say, hey, listen, doc, I've stopped this med, this med, this med. I started this slightly, and these are the results that have been beneficial. And you almost have to, change. I'm not going to say everything that you've been taught, but there is a stepping back of like, almost a separation, and you have to listen a different way in order to start seeing and hearing it properly. Because a lot of times, even me as a patient, when I hear someone say, oh, I'm a medical marijuana patient, sometimes I'm like, really? Like
you patients questioning patients for sure.
Yeah. And I don't think it's like, it's not in a negative way. It's more so just a surprise almost. And I think as a physician, that first couple times around hearing that would be a major surprise.
Yeah, it was just eye-opening to see. And the thing is what people don't really understand unless you're in medical school is that the pharmacology curriculum and the things that we're taught are kind of aligned with what the pharmaceutical industry wants you to do. So, you're taught about all the drugs that they produce and all the things that they say are what's best for the patient. But, there's underlying financial motives behind that. And in medical marijuana, it's really not any big pharma companies that are able to make any money off of this at this point. So it's kind of this area that's hard to really study and evaluate as a physician. You don't really know. So all you really have is anecdotal evidence from patients that come in and say, this worked for me. It doesn't mean it's going to work for everybody, but it worked for them. And as I started seeing that more and more in my traditional practice, I knew that there was either definitely an opportunity to help people in a different way. And I thought maybe even a good business opportunity as well.
I just from both of you, actually, do you ever think sometimes, and I'm curious, especially from you, Dr. Dugar, kind of living in it day to day, when I hear patients or when I hear advocates or legacy people scream about big pharma and conspiracies to keep cannabis out of states and legal and stuff, is that entirely real? Is it sort of real? Like when you're, in your opinion, and like being in there, and Dustin, I'm curious from you as well, like when you see that, because as someone who has that realistic ability, when a patient says, are you really? Because you kind of might be using it a little too, right? Recreational. I hear that a lot. I hear a lot of rallying cries against big pharma, and they're keeping us down, and we'd have legal weed everywhere if it wasn't for big pharma. Are they the ultimate villains of the story? Are they a henchman? Are they a henchman, or are they the big bad of cannabis is not being legal and not being more accessible, in your opinion, Dr. Dugar?
Well, I think it's a little bit, it's not as black and white as that. I think big pharma is necessary. They do a lot of great things, and they provide us with a lot of medications for cholesterol and things like that are necessary, right? I think the problem that happens is that without big pharma being involved, it's hard to really get proper studies to validate what benefits marijuana can have. And the reason they don't do studies is because there's one, it's federally illegal, and two, there's no financial incentive for them to do anything yet. So as soon as there's a way for them to make money or to get to make products that they can patent, like cannabinoid products, instead of just regular flower or regular cannabis, they want to patent something that they can sell and have a monopoly on for some period of time, right? To recoup the cost of making the drugs. That's when I think it'll become more mainstream. So I do think, unfortunately, they are kind of part of the roadblock that's preventing legalization to happen nationwide. There's also a lot of lobbying that happens to Congress and things like that prevents these bills from getting passed. And so I don't see that changing until big pharma has a place at the table where they can actually make money off of cannabis.
Wow. Yeah. I can't imagine it any other way.
What do you mean you can't imagine any other way?
Well, I don't know. There's this idea that to me that's like the big money that is being donated against cannabis usually has a tie-in with something like that.
Yeah.
You know, and that anti-labbing effort, is there, just because they don't have the money in it, is it really taking that much money from them in certain regards? I mean, is cannabis really the end all to their profits? I think of a lot more very highly specialized things that they're trying to accomplish. And I just think that cannabis, I don't know. It's funny that they see it as a threat in such a way, or I'm going to donate $100 million to fighting against it just because I don't have my pockets in it a little bit.
I don't know if it's that big. I feel like the threat to the big pharma is overrated too, right? It's kind of like the threat that cannabis consumers, especially in legal states, feel if their cultivator doesn't allow home grow. They get so mad at them. And I'm like, or of a cultivator in a large state being against home grow, because it's not going to make a dent. If you have caregivers growing their own product, it's not going to make a dent into your budgets, right? Those states are still making billions, right? Florida still makes billions. I mean, there's a ton of money. So I don't know. I feel like it might be a little overrated. Do you think big pharma, do you think traditional medicine, Dr. Dugar, do you think they're worried about cannabis taking away, like they're like South Park, they're going to take our jobs? Is like cannabis going to take the doctor jobs? Is it going to take their jobs away from them? I don't think it is, but that's the way it seems sometimes.
Yeah, I don't think so. I mean, you know, cannabis is just a tool, just like any other medication, right? So you still need the doctor to determine what's the best thing. And I don't think cannabis is the best thing for everything. I think if you have to choose between opiates and cannabis is probably less addictive and lower risk than opiates. If you have to choose between cannabis and meditation is probably going to be better for you than cannabis. But a lot of people don't want to meditate, so they'd rather just use cannabis, and that's their meditation, right? So I think it's a spectrum of options. I do think that, depending on your specialty, the most common things we see are patients using cannabis for chronic pain or mental health conditions. Mm-hmm. So I think that physicians most concerned or maybe most at risk, if there's even really much of a risk, are probably like pain physicians or psychiatrists or people like that who are kind of prescribing pills that the patients maybe don't want or maybe are not effective or have bad side effects. And that's kind of where I see it as more of an adjunct to where they can maybe take a little bit less of those pills, supplement with a little bit of cannabis instead, or maybe even get off the pills completely. But, you still need the doctor to help them through that process.
Yeah.
You still need a doctor to talk to about your mental health issues. Cannabis doesn't get rid of mental health issues. It may help you feel less depressed. It may help you feel just happier about life. But, it's still a medication. You got to keep using it or that feeling goes away, right? So
great.
I see it as I think there's just a lot of fear among doctors because as a whole, physicians tend to be very by the book. They kind of have a protocol of how to do things. So then when they have this new wrench in there, that's like, oh, well, this patient uses cannabis. They don't know what to do about it. And that's why there's this void where there's all these patients that want it and very few doctors who are willing to give it to them. And that's causes that's what opened the door for a business like mine.
We've talked to a few doctors, Dr. Hamant Bid, who, have spoken about the lack of drug-on-drug interactions or testing done with cannabinoids. So it's, I could see that fear with them that says, I don't know how the heck this is going to interact with you to this medication I've prescribed you. So thus I can't support it in any way. And I think once they're given a little bit more data and there's more process involved that allow them to do the testing that is needed, I definitely can see it being used more as a tool or in close coincidence with something else that they're prescribing. I just think that fear of that unknown is just so high that I don't blame them when you're thinking about someone's true health in certain regards and you are prescribing them something. You have to think under those terms and have that high apprehension in certain regards.
Yeah, I absolutely understand that. I mean, a lot of these doctors are not doing cannabis medicine, right? They're doing their traditional medicine, and then they get these questions and they're not sure what to do versus practice like ours where all we do is cannabis. And so it's like, that's what we're well versed in. We can answer those questions. But even then, we still encourage the patients to work with their primary doctor, even if the primary doctor's not the one prescribing them the cannabis, so that so that we're not just dismissing everything they're doing with the doctor and saying, use cannabis, it'll heal everything, because that's just not true. It's just another tool, just like everything else that you get from the doctor or the therapist to help you with your life.
I appreciate that statement as well, because I think that's a problem with a lot of doctors, or not a lot of doctors, but a lot of maybe sometimes on the patients or even on the caregivers and these such, as it is sometimes self-prescribed. And even though as many as smarter people and us have said, sometimes you're medicating without realizing it as an adult use or a recreational patient. But there are some doctors who even cannabis recommending physicians look at it as magic, right? And it's not. And so I appreciate that Dr. Anand Dugar here with Green Health Docs, greenhealthdocs.com. And so I appreciate kind of that way of thinking. So I'm sure it's that way of thinking that in some time around, 2015, 2016, before you opened your first store, somehow you ended up in Maryland. I'll have to hear how you got from Texas to Maryland to get that first store. I get that you had the doctory side, right? You went through this training, you go through all your certifications, you take that, but opening up the business of being in the medicinal cannabis business, there's that second part of it, right? Had you had kind of that traditional background, were you nervous about that part? You probably felt comfortable with patients and the medicine, but the business side of it, I feel like for physicians, especially since most cannabis physicians in a lot of legal states aren't typically supported by big budget systems because of reasons like here in Ohio, the three major systems, SUMA, Cleveland Clinic, and University Health Systems, can't touch it, right? You can't be a doctor for those systems and recommend cannabis. Right. So that takes away the majority of doctors in our area work for one of those three big conglomerates. So what was that like, having the doctory knowledge and then going into the business and looking at rent and looking at common area maintenance charges and payroll? Like, how was that process as you started to think about, I'm going to open my own practice?
Yeah, I mean, it feels like forever ago now, but when I first started, I didn't know anything. I barely knew what to do, right? I didn't even know how to find a property. I didn't know what lawyer to hire. I didn't know, how do you hire doctors? How do you hire receptionists? How do you do any of these things, right? So what I did was I actually hired someone who had worked at a similar type of practice, and they helped me learn the business. And so in most things in life, and this is something Tony Robbins taught me as well, is you want to find a mentor. It doesn't have to be the best person in the world. It doesn't have to be like, you don't need Bill Gates to teach you business. You need someone who's like one or two steps ahead of you, who knows enough so that they can keep telling you where to go. And then you take that knowledge, and I use that. And eventually I became, more knowledgeable than the person that was helping me, to where I outgrew that mentor. And then I had to find new mentors that knew that could help me with, how do you hire more people? How do you scale teams? How do you do things like that? But I just was getting disillusioned with medicine, and I didn't want to practice doing what I was doing anymore. And I just honestly just took a leap of faith and just believed that what I was doing was going to help people. So I just figured that the universe would make me successful if I just had the right intention.
Yeah.
I'm glad it worked out.
It worked.
Well, there's a lot of avenues that you could have gone for patient care in this industry. What made you want to work on the problems with card issuing, or what specifically led you into that direction? Because you could have found a mentor in any numerous parts,
all the medicinal aspects, the research. I mean, there's lots of ways, and we've talked with a lot of great scientists. You could go down a ton of paths into it. You could have specialized in maybe some of your, effects with, anesthesia, or maybe even ENT stuff. So, but why go into kind of, I guess, the general practitioner, kind of the recommending physician role versus some of the specialists behind the scenes researchy stuff?
Yeah, I mean, it was basically because I thought this was the area that I knew the most about. I had never been a big research person in residency. Wasn't really my passion to do a lot of research. I like more of the clinical aspect of things. And I had seen the setting, like it was a very familiar setting for me to be in a clinic and see patients and have a receptionist and use this electronic medical record system. And so I knew the pieces better there than I would if it were to be to say start a pharma company or a research company where I would know almost nothing because I had no experience at all. So it was kind of just the path of least resistance, where I felt that I knew something, so I had a better chance of success. And And at that time, I mean, I was just hoping that I could open up one clinic and maybe not practice medicine and maybe more focus on the business side of things.
Mm-hmm.
And so I didn't go in thinking that we would be seeing like thousands of patients like we're seeing today. I just went in trying to just make one clinic work and just learn how to do that one clinic. And when I saw that it worked, then I saw that I had a formula that I could copy in more locations. Right. But it was really just, everyone wants to create $1 billion tech company, but if you don't know anything about tech, that's a stupid thing to do. You're probably not going to work.
Right.
So I just chose something that I thought was easy for me to understand and succeed in, that I didn't need to hire a ton of other people to help me do. Because in the beginning, you're basically doing everything. I was answering calls and talking to patients and booking them for their appointments. I was the receptionist checking in the patients after I hired a doctor. I was the first doctor seeing the patients before I hired that doctor. Mm-hmm. So like I knew I could learn or figure out how to do all of these roles. Mm-hmm. But when you're trying to build something like a pharma company or a research company, I'm not even sure what the first thing would be to do. Like I still don't know what the first thing to do is. So that's kind of how, that it started. It's just a lot of trial and error. And what happened is I was reading a lot of medical journals and like getting emails from the anesthesia journals and things like that. And I would just look for cutting edge stuff. Like I didn't want to just open up a clinic that was going to do primary care when there's thousands of those already. So I was like, what can I do? And this is something also that Tony Robbins reinforced too during some of his courses, is like, how do you make yourself different? Like everybody's going to sell cookies or whatever the product you're going to sell, but how is your product going to be different? And I knew that this was a niche that was underserved. So I thought I'd have the most chance of success doing something like this.
Mm-hmm. How long into kind of this, when you're opening this first store? Oh, by the way, why Maryland? I don't know if we got to that part. How did we end up? You've been in a few places. You were in Texas.
Yeah.
How did you end up in Maryland, out of curiosity?
Well, so it's interesting. The way the cannabis industry works, right? Each state is kind of its own market because the laws change in each state. And Maryland and Florida were the two states around that time that both were like going medical. And I was like, okay, so I should go to one of these two states. Mm-hmm. And my girlfriend at the time, is also a physician. She was starting her internship, her first year after residency, in Washington, D.C. So it made perfect sense for me. Well, why don't we just open up in Maryland? So I basically lived in Washington, D.C., but we opened the first clinic an hour away in Frederick, Maryland. And I would just commute there and work with the team there. And this way we both were able to do that. She could do her career. I could do my career. And then after she finished her residency, after her internship, after the first year, the team was functioning without me. And that was when I was able to leave the area. And it's been a remote company really since 2018.
Wow. Yeah, it's funny that you said if you don't start a tech company if you don't know anything about tech, but in a lot of ways, your company has become a tech company. It has gone from this physician office to this almost highly automated and highly tech backbone, operation. And I'm curious at how you see the growth into that role being a tech company. And also, like, I'm curious at what changes even during COVID with the telemed, like national or federal laws that are changed that allow these doors to open up in an easier way, or some of the roadblocks that some of these laws may have, because you do have a lot of states you cater to. And I thought a lot of the laws were recently changed about a couple years back to kind of allow more fluidity with that, to kind of, and I'm just curious at how that affected your business in general.
Yeah. I started off in 2017 opening up physical clinics, just like you walk in, see the doctor and leave. And the doctor's physically there as well. And that's what I did from 2017, 2018, 2019. There were states like Oklahoma that allowed telehealth, but to be honest, I think I was just scared. I didn't know how to do it, and I was nervous about it, and I was kind of just staying in my lane of opening up physical locations because that's what I knew how to do best. And then when COVID happened, nobody was going to the locations anymore. And I realized that we had a problem. And at the same time, the laws did allow telehealth in lots of states that previously for medical marijuana would not allow telehealth, where they required an in-person visit. And that is when I basically took about 2 weeks of like nonstop 14, 16-hour days. And I redid the entire company structure. I didn't build like a big telehealth platform. What I did was I found really good third-party softwares that were already doing all the things that needed to be done. So I didn't have to create anything. And I was able to put those together into a seamless fashion to give the patient a very good customer experience on the front end when they were booking their appointment, and also for the doctors on the back end so they could see the patients well. And that's still how we run the company. We never built our own technology software because you could do that, but it's not going to be as good as a software that you buy or you get for $50 a month or something, right?
Absolutely.
That these little softwares that have thousands of users that they've spent millions, if not hundreds of millions of dollars creating. And that's, I think, part of the mistake that a lot of people do is they go build these crazy platforms and there's no demand and they waste all the time building a platform. So I never did that. I just focused on demand and making the customer experience wonderful. That was the only goal I had, is to make the customer delighted when they leave. And it's pretty easy when you give them a marijuana card because they're pretty happy.
It's part of the job.
Yeah, the doctors love the job because this is probably the only job where patients are happy. They don't leave.
Yeah, they don't get it. I owned a high-end glass smoke shop, and that was the thing I always said was, I think in 7 years of owning the store, I think I had 2 angry customers, and so like that's a really positive thing to know. Today I'm going to wake up, I'm going to go to work, and I'm not going to have to eat shit all day. It's just I can really focus on helping someone or listening to really what their problem is, and I have all these other tools to be able to help provide them. So I think it's a great industry to get in terms of that.
It's an interesting thing to talk about because, you bring it up, like you have in this weird way, like this great job. I get to give you access to this plant that for some reason in a lot of states, you got to require medicinal access. I was just having this conversation with someone recently. So we're in Ohio, which is a state that Green Health Docs, greenhealthdocs.com. You can find the link right below in the comments, works with. But we have a lot of issues. They're talking about it all the time. It's not a very highly supported medicinal program here, but the patient counts are stagnant, if not trending down. Like, so we have all these dispensaries opening up, all these cultivators, but we have hit a plateau. We have neighboring states, for example, Pennsylvania, 2.6, 2.7, just under 3% penetration rate. Michigan, obviously above us, adult use and medicinal. Neighboring states, even Kentucky, just went medicinal right below us. But we can't do above, like, I think we're at 0.8% the last I saw. We cannot get patients to get into the program. And everyone keeps talking about it's patient education. They have to learn there's medicinal cannabis. I'm curious on the doctor end, and you work in the state of Ohio, you have a service there.
Yes.
Why, in your opinion, do you think a state like Ohio, is it just conservatism or what struggles with getting the patients? Maybe it's the adult use that is our neighbor. I'm not sure, but it's something that's a hot topic. And it seems to be, it's not access. I can go right now to greenhealthdocs.com, start the process on the system that Dr. Dugar has put up and have worked that process, right? There's lots of great services. Why are states struggling with patient counts, states like Ohio?
I think the main reason Ohio isn't growing as rapidly as, like, say, Pennsylvania is because the only mental health condition Ohio allows is PTSD. They don't allow anxiety. They don't allow depression. But Pennsylvania does. So see, the key in a lot of states is what conditions qualify. And this is where a lot of people don't know, is it's not the same in every market. Like some states, any condition can qualify. And in some states like Ohio, you got to have PTSD. It's got to be diagnosed by someone, and they got to say you have that exact diagnosis. You can't say you have anxiety. It doesn't qualify.
And you need a very specialized doctor, physician to give you that diagnosis. You can't just go to any, and my family practice and get that diagnosis. So it is incredibly difficult to manage that.
The other part is true too, that, if there's recreational access, sometimes patients will go there if it's close by in a neighboring state. The other thought is that, the dispensary prices can sometimes be too high for patients. Many of the patients are, lower income patients. And so they may get the card because they want legal protection or feel like they're safe from police or anything like that, but they may not purchase directly from the dispensary as well, which is unfortunate because that's where the tested and and legal product is, you know what you're getting. But we have to be realistic. I mean, the prices, the black market is definitely still the main competitor to the legal market. And there are still more people are probably going to the black market than they're going to any medical or recreational market in any state, because that's still cheaper on average than going to the dispensary, because they have so many costs and they have all these 280 restrictions where they can't even deduct expenses.
Yeah,
so they're very hard for them to be in the green profitably in that business.
I want to ask you a question that I feel like everyone asks me when I talk to them about it. We work in education, we do these things. And so we talk about a state like Michigan, and I see you're in Illinois. You're in a few other states here that are both medicinal and adult use. And so in a lot of times, you're Washington, D.C., you got a ton of places. You have both medicinal, adult use, Oregon, right? Tons of weed in Oregon, right. Tons of it. Everyone says, why is there medicinal cannabis in states that have adult use? So I understand the reasonings, there's price points and such, but I've never had the opportunity to ask a multi-state operating doctor, is it worth it to be a medicinal doctor in Oregon, where you can have the price per pound in Oregon is so low right now. The cannabis is not that. What's the benefit of having like a medicinal card or being in a marketplace like in Oregon or California that has all the legal cannabis you want to have?
Yes, exactly. So the main reason people will still get a card in these markets, and some of the best markets are like Washington State and Illinois, is because they have significantly higher taxes on the product if it's recreational versus medical.
Yes, 14%, 18%. It
right.
Could be astronomical in some cases.
Yeah, like Washington is almost, I think, 37% or 40%
yes.
difference if you have a card versus not. So that's why we still see patients in a lot of these rec states, even though they have the rec program. California is a little bit different because it's really an age thing. 18 under 21. You can't get recreational marijuana, so you must have a card to get cannabis. And so it kind of varies based on age and price. Those are the two main things that are why people will keep getting the card. So now if you're using it infrequently, maybe the card may not be the best, may not save you money, because you do have to pay for the visit with the doctor and things like that. So it has to be kind of calculated based on how much you're consuming. But the average consumer that we see, and that what the dispensaries report through a lot of these Headset and other companies, it seems like they're spending a couple of $100s a month on average. And so if you're spending a few $1,000s a year on cannabis and you're able to save 40% in Washington, it's a no-brainer to get your card from like a company like ours, like Green Health Docs. And this way it's one time a year, and you basically, every time you walk in the dispensary, you're saving 40% every single time. So that's the main reason that I see that patient volume doesn't like go to zero in these recreational markets, because there's still that benefit, which may or may not change over time, right? We just don't know. Government changes.
And there may be actually adverse effects from getting your card as opposed to just being on the recreational market. In Ohio, if I am a medical patient and I get caught with my medicine, it better be in a vaporizer. It better be in some other device that's not a pipe that I can combust it in, or rolled up in something. In Ohio, if I have medicine that was bought on 3 months ago's prescription, technically by law, I'm not supposed to have that prescription under my new prescription.
Use the terms, Dustin. It's a recommendation, never a prescription. You know that.
So we got federal rules. The idea here is that I have a lot more rules that I need to follow now. And if I was to get caught without my prescription or recommendation, at the end of the day, it would be a $60 fine, and I could just get the heck out of there. It wouldn't even matter. But because I'm a patient, now I have a lot more laws that I actually have to follow, and a lot more rules, and a lot more danger. And so it doesn't always work to the benefit. I have to kind of weigh out what I get, what I won't get out of it.
Yeah. I think the main benefit, if you get stopped by a police officer and you have cannabis, or you're intoxicated, or they see it open or something, right? I mean, you're still going to get in trouble in the sense that they're going to be like, what are you doing, whether you have the card or not?
Absolutely.
What I have seen, though, that's interesting is in some states, when a patient gets in trouble, and I don't remember off the top of my head, but I've seen where they've gone to court and they've won. So they didn't get in trouble because they were a medical patient. So a lot of patients will get the card they don't want to buy the medicine at the dispensary, which, as I mentioned, just for whatever personal reasons, probably usually financial, but they just want to have the card because it gives them peace of mind that they can say, well, look, I'm a medical patient. I know this isn't maybe the right product I'm supposed to have, but it's really helping me. The other stuff I couldn't get. And we've seen things like that happen, or anecdotally, but we always tell people, you got to follow the rules. I mean, if they say you're not supposed to smoke it, or you're only supposed to vaporize it, then, don't be stupid and don't smoke it in public. Do it in your house if that's what you're going to do. But, you got to just follow the rules so that you don't get in trouble. But it's fortunate that most of the police are pretty lenient these days with just like possession. Now, if you're intoxicated, that's a different thing, but just possession, they usually give you a misdemeanor or not even, or it's just a fine, like you mentioned.
It's becoming more and more decriminalized. We just had 200 grams or less decriminalized in our area, stuff like that. It's funny, you talk about kind of police are being more relaxing. The other side of cannabis legalization, the other side of this is the media, is the horror stories, is the, oh my gosh, what about the children things? And doing a little bit of research, Googling, looking for past interviews. One of the things I found out with you, Dr. Anand Dugar, you were just in a story recently and from Missouri, like a news story about one of those, my kids ate gummies, they're probably going to die. And you had to come in and say, they're not, just be careful to prescribe medicine. So when you get those calls to be on the media, do you get excited for that? Are you like, hell yeah, we get to promote greenhealthdocs.com right now. I get to be the expert. And B, how has that been dealing with these types of things and patient education? Is that something you have to remind them, like these treats or these medicinal things can look like treats. You have to be careful because sometimes they are produced and manufactured to make, yummy objects, and so you have to be careful. But it's the same to me as the Tide Pod issue, right? It's still that same thing. It's education. But you have these stories that pop up. Do you like being kind of the media guy? And then what is it like with patients and education and children, right? Because there is a need. Right. They're not going to die, but there is a need to keep them away from THC, right? It's not for young kids unless, we're prescribed with epilepsy and such.
Yeah, I mean, I love talking about what we're doing because, it can reach more people. And I don't want to convince anyone that they should use marijuana. I just want to give them options, right? I mean, a lot of patients will go and try different things. It's not a one size fits all where you just go to the dispensary and you buy this thing and you're going to be perfect. Like some patients, this works, and some patients, they try that and it doesn't work for them, but it worked for somebody else. So to some degree, there's a little bit of trial and error, but I think anytime we can get more exposure for Green Health Docs, obviously I enjoy that. And anytime we can get more people, right? Anytime we can get more people aware that there even exists a program, you'd be surprised how many people in Ohio probably don't even know that there's a program at all, even though it's been there for years. I used to see that in Maryland in 2021. I think I would talk to people in Maryland and the program had been there for 5 years and they were like, oh, there's a program here? It's because of the advertising regulations and restrictions, right? So it's hard to get awareness. But yeah, sharing things with the media, I think is awesome. And I appreciate when people reach out to me. And then with the kids, I'm also I really don't like to give marijuana to people under 18. We have on rare occasions, very infrequently, if they have epilepsy, and I often get involved to talk to the patient as well with the doctor. That's how infrequent it is. It's not a common thing because, we just don't know. If you give a kid who's 12 that has anxiety or ADHD marijuana, I don't think that's probably the best.
I don't want to stunt other brain development to fix some other thing all the time. You got to outweigh.
And I think it's all right to have that honest opinion. I think that's the other side of sometimes cannabis as a medicine is everyone's so gung-ho on give it to everything for everything. It's not an elixir like for the medieval times. There are some negatives. Like you said, we're still learning because we haven't had the federal research what it does to brain development, particularly in younger, undeveloped under 25-year-old brains.
Yeah. What are some common misconceptions that you see new patients coming in asking about?
Well, a lot of them think, they don't realize that there are many options besides smoking. A lot of them think that the only way to consume marijuana is like joints or flower, or maybe they heard about vaping, but they don't know that there's tablets, there's liquids, there's like liquid/tinctures, there's gummies, there's chocolates, there's drinks, there's so many different ways that you can consume it. And the older population tends to not want to smoke or do anything that's inhalational. And the younger population tends to be more into the flower and vaping type of things, which kind of makes sense if I think about like, you know, history, my history growing up and friends around me, like kind of at some point people start smoking or whatever, and then they kind of don't want to smoke anymore and they transition over to gummies or maybe off weed completely, depending on who they are. And so it's just giving them the awareness that, hey, it's not like the old times where you just go get a baggie from somebody and that's all you get. There's a lot of different ways to do this so that you don't have to hurt your lungs if you don't want to smoke, because nobody should be forced to smoke to get that feeling that you want. There's so many other ways to do it. That's probably number one. And then number two is just understanding how the process works after they see us, right? So after they see the doctor, a lot of times they have to either register for the state to get approved as a patient holder. Like the state has a registry that's private. Nobody can get access to it, but they need to be registered because that's how the dispensary knows that you're a legal patient. And your driver's license is tied to that usually. So you can just show them your driver's license to get in. But it's just the process mostly is what they're not clear on. And we pride ourselves on making sure that they understand that and that we help them with the registration part too with the state if they need help with that, so that they don't leave with a doctor approval that's basically worthless because they didn't get registered with the state.
Yeah, you're halfway there.
Yeah, like we got our money from you, but we want to make sure you also get your product, right? We want to make sure we help you all the way through.
Is every state have a fee? Like Ohio's is $50. No matter what you say on your site, like I tell everyone, they just know the state's getting their 50. Like you just
it wasn't always 50. When I first did it in the state, it was 150 or it was over 100. Really? It was expensive. And then it cost me 250 for the doctor recommendation and to get that all set up. So I was in over $350 before I ever was able to go to the shop and buy my 10th for twice the price of me. You know, so I mean,
there's always there's some fee. Usually it's less than $100. There's fees I've seen as low as 25, and I've seen higher ones too, right? Depends on the state. But as time goes on in most programs, they tend to lower the fees to make everything more affordable. I think in the beginning they're trying to recoup some revenue, all the costs they did to set up the program and things like that. And then as the program grows, they're able to reduce the prices. But yeah, we got to pay them to exist, right? Like they're doing an important role. Without them, there is no program. And so it's kind of a necessary thing, but they try to keep it as low as possible to help the customer, to help the patients.
I have no problem paying it as long as it's easy to pay. Sometimes.
Sometimes working with a state can be a huge issue, like just trying to get them payment or get documents because they're like, we still work in paper. I'm like, come on. Thankfully, Ohio's, you got to list a little bit there medicinally. And it's funny you talk about that. I often, when I hear people say it's more than just flower, it all is so mind-boggling. I mean, Dustin and I were around it all the time. Everyone I talk to works in the industry. They're always talking about the newest and the greatest and disposables and nebulizers and all these other things. And then a lot of patients are still like, am I going to get caught with the smell? I'm like, there's no smell. It's breath sprays, people. It's so changing and evolving. Where do you think, as cannabis continues to grow, we get to some sort of, whether it's adult use legally, federally, I don't know if that matters at this point because every state is kind of progressing. Where do you think the state of cannabis medicine heads to? Let's say we do go federally legal. Does that negate a medicinal program? Is there always a marketplace for medicinal? I'm always trying to think, and I'm not in it, so I don't think about it often, but what is the role of medicinal cannabis if a country has legal cannabis and it's open to everyone, and then the prices plummet and state exportation becomes easier and rules are regulated? What role does medicinal cannabis, or how do you guys fit in that world?
Yeah, I think about this a lot, right? Because this is what I do. And so I do think there could come a day where there could be legalization nationwide. And if there's no benefit to having the card, like there's no tax benefit or there's no legal benefit or any real benefit, then I don't see a reason that people would continue to get a card. The reason they get the card is basically because of the tax benefits or the legal protection, or there's some additional reason, or there's no recreational program, obviously. So I do see that as something that could happen, but I also see a need for there to be education and for more doctors to understand how to work with patients to kind of provide them with the best information and guidance on that. So I've always thought about that as another avenue that we might go into as well, as things continue to develop. But, you know, if we're going to use it as a medicine and use it to help people with certain conditions, most notably chronic pain and mental health conditions is what we see the majority of, then there's going to need to be continued physician involvement. There's going to need to be regulatory boards to really study these things. There's going to need to do more medical studies. Maybe I'll have to get more involved in research.
Get that research hat on. Gonna have to add that to the serial entrepreneurship that is Green Health Docs. Add Dr. Dugar doing the research, finally getting into it. Not finally, you obviously.
We try to do some like anecdotal studies where we reach out to patients and ask them, you know, which products they like, what's working better for them and not. But it's just not it's not robust. And there are many apps out there like Relief app and things like that, where you can like log your symptoms and see how you're doing and what products you're using. And they're good, but it's a lot of manual work and like patient, and you know, it's hard to get patients to comply to enter every day when they take something and how they're feeling. And so it needs to be more automated so that it's like easy for them to do.
Gamified
Basically. Right. But yeah, I mean, I think we're a ways away though. I don't, you know, unfortunately for like the country and for patients, I don't see like full legalization happening in the near future. I think, as I mentioned, there's going to have to be like pharmaceutical interest to like kind of really get it that way, because I mean, we have to be honest. At the end of the day, I mean, all these are businesses, and if they see another avenue, they want to get in that. So they're going to find a way to get into that business. When the opioid business is going down, they're going to want to get into the cannabis business, right? Or when the cigarette business is going down, they're going to want to get in the weed smoking business. So once these big companies start to get involved and lobbying is going in that direction, that's when I see legalization probably happening. But the way it's been, I don't know if we'll even have legalization in the next 4 years, even with the next president, no matter who it is. So
I think it's amazing that you were even thinking about that. 4 years, you know, even if it was 8 years, that's unbelievable. When I think about,
there is a time during COVID and things like that, even you know, going back with Trump politically, and between Obama and then the wild card that was Trump and COVID, and trying to just get supporters and likes and all these other things, especially when cannabis, you know, like with what Green Health Docs at greenhealthdocs.com was able to go with, was the rise of telehealth and all those things. I thought for sure in that moment, I thought we were close. But I agree with you, Dr. Dugar. I feel like a few years ago, I thought we were close. I don't feel like it's anytime soon. There's no need to it. The states keep legalizing, even though we're under a traditionally liberal, more likely to legalize cannabis leadership at this time. It feels like we are farther away than we were under Trump, which sounds crazy to say out loud, but it feels like we are. It feels like I thought for sure Obama, we're getting close. The rise of Colorado, Washington, the Cole memo, we're like, all right, some traction. And then Trump is like, oh no, but then he's like crazy. Does he do it? And then Biden, you're like, yes, the first year with Biden being reelected, I don't hear any talk of this stuff, or with him running for reelection. I don't really hear that as a hot topic. And even stuff like the SAFE Act and things don't seem to be like they're there, but it doesn't seem to be a push. So it feels weird. It feels like we're pretty far away, even though it's exciting, Dustin. I get it, but I don't see it coming. I just don't see it in my gut. It would be shocking if would you be shocked if we legalized in the next 2 to 3 years? I'd be shocked.
I'd be shocked.
Yeah. I mean, I think the first step is going to be passing the safe banking and getting rid of the 280E provisions that are preventing a lot of these growers and dispensaries from, you know, really being profitable. It's very difficult for them because they can't deduct anything basically except for the cost of the product, but they can't deduct expenses for the employees, any of this stuff. It's all considered non-deductible. So I think we got to see that happen. And there's also, unfortunately, there was a law, like a bill to try to get the VA hospitals to let their doctors give the patients cannabis. Looks like that's going to fail as well. So, you know, it's just, there's always these hurdles that come up, and I would have loved to let the VA hospitals give a lot of these patients. They could just get it from their doctor at the VA, but they're not able to do it. And we obviously are happy to take care of them, but you know, it'd be easier for them to just go there and or they're getting all their care. But so until those things start changing, like those big things, like the VA hospitals, the Safe Banking Act, the 280E, I don't think anything's going to really change. And then maybe they'll legalize nationwide, but we've still got about 10 more states to go. So maybe when all of them have medical programs, at least, that'll be a starting point. But there's still states like Wisconsin, North Carolina that, you know, big states that don't have any program at all.
A lot of the South, like the conservative Bible Belt,
Yep.
like Kentucky was first. They were the first stone, so to speak, to fall. But the rest of them, even though they're big in the CBD, Carolinas love growing hemp. They're farming it. They just don't want to touch it. Even though Florida, we know, is $1 billion medicinal state. I mean, Florida's doing billions in medicinal cannabis there for that. We are talking with Dr. Anand Dugar from greenhealthdocs.com. Dr. Dugar, thank you for spending this time with us. Quick question. Have you got to know as you've gotten a little down the road, like, if you get comfortable with your strains and your terpenes, do you have like certain things, per describe, like you go to like break out of the belt? Are you more comfortable with that world?
Yeah, I know that the world well. That the issue that is like, depending on the state you're in, you'll have different brands of product, right? Because there's different dispensaries and growers in those markets. So we try to guide patients. What we do is we understand the basics so that for the people that don't know anything, we try to give them the basics of like what sativa is, what indica is, what a hybrid is, how these work, onset of effects from different substances. Smoking is like immediate. Vaping and smoking tend to be immediate versus edible will take longer, right? Yeah. So we give them basic knowledge. And then a lot of the time what we'll do is we know which dispensaries have really good, what they call bud tenders, who are almost like pharmacists because they basically are helping the patients with the medicine to choose. And so we give them, the doctors sometimes will give them advice on products, and then they'll get that advice from the bud tenders. And then it's really a trial and error process. Unfortunately, there's no guaranteed way to know this is going to work, but we tell them just buy small amounts. Like, don't buy a big bag of flour. Instead, maybe buy one pre-roll and see if you like that flour first. So you don't waste $60 on something that you maybe didn't like, and you can spend $15 on the pre-roll instead. And so it costs a little bit more maybe at the beginning. And then once you find the stuff that you like most people, you kind of stick with those things. But we try to give them enough education so they don't walk into the dispensary and they're totally confused.
Yes.
Like,
or scared. Yeah, that you can at least ease some of the fear that first time around. And after that, they can build the rapport with their bud tender and their shop. And
yeah, because I live in California and I've walked into dispensaries here, and it's pretty, even for me as an expert and in the field running a business, even I'm like, there are way too many products here. I have no idea what is.
Yeah, how the hell am I going to use that thing? It's just oil in
you see everything
right there, like
sprays, pills.
I get a little confused sometimes. I think I see some things that when I started seeing like the rosin syringes that you could then fill your own, and I'm like, what is all like? And I'm around it, like you said, you were around it all the time, and I'm still like, what are they doing? Slow down, stoners. Just let's do something basic sometimes. But then you get into things like pills, nebulizers, where we're giving completely much safer ways to consume. No, as you said, no smoke and whatnot. So those things, I'm all about the nebulizers. I can't wait till those get to Ohio. I find those fascinating. I just think it's cool. I think it's cool that we're thinking that way. Like, we're thinking of it. Yep. That showcases to me thinking of marijuana as a medicine. Right, which is what we're trying to do here. I would be remiss, by the way, on an episode of Medicine and Marketing Because Cannabis, before we let you go, to not give a quick shout out to Green Health Doc's social media. You have a woman who's all over your social media. She's doing an awesome job. Let's give a shout out to what was her name?
Yeah, Marley. Marley is our social media coordinator. She
promote the show, Marley,
and she does all the amazing posts that you see and tries to make you laugh and smile and just give us some education as well. And so
Marley, you got to promote the shit out of this show. That's all we're saying right now. Get the show out there, Marley. Let people know. We are talking with Dr. Anand Dugar, Green Health Docs, greenhealthdocs.com. Thank you very much for spending an hour with us today, talking about cannabis, talking with what you're doing with Green Health Docs and greenhealthdocs.com. You can find the links to some of those social medias we just talked about on Instagram and Twitter, as well as greenhealthdocs.com website in the comments below. Thank you, Dr. Dugar. We will talk to you soon.
Thank you.
All right, everyone. That is another brand new, exciting episode of Because Cannabis here on Wayward Media, wayward.media on the interwebs. Dustin, as always, man, great show. Great having you here. I love learning. I love learning that stuff and getting to talk to different people onto there. Thank you, everyone, for joining us. Don't forget, please subscribe. Follow us social media, all those good places, @MeWM. Dustin, I'll see you next week.